Hello, everyone, and this is another episode of the What Podcast, Wellness, Health, Advocacy, and Transparency. Filling in for Dr. Sheffield, I am Kazan Allen, the intern with the most. So we have some special guests, and we have been wanting them for the longest, but it's Women's History Month, and I feel like they should start off the month really well. So let me introduce our guests. We have Dr. Smith and Dr. Maignan. So, y'all can say hi to the cameras.
Well, good afternoon, everyone. As stated before, I'm Dr. Ukamaka Smith, an Associate Professor of Pharmacy Practice here at the College of Pharmacy and Pharmaceutical Sciences, Institute of Public Health.
And I am Dr. Maignan. I am an Assistant Professor here in the College of Pharmacy, Pharmaceutical Sciences, and Institute of Public Health. And it is a privilege, and we're excited to be here today. Thank you for having us.
Thank you for coming.
Thank you.
And like how I said before, they are starting off the What Podcast for Women's History Month because they are partnering up with Duke University for the Pharmacists for Prevention P4P project. So Dr. Smith, can you explain what the project is?
Yes, of course, and thank you so much for that question. The P4P project is Pharmacists for Prevention in collaboration, as stated before, with Duke University. This is a project that is long time coming with us in collaboration with Duke, and it's an NIH-funded award that we received. And so with this particular award, our plan here is to train and continue to train and improve our efforts and strengthen our curriculum for our pharmacy students. And so this gives the opportunity to not only evaluate our curriculum, but also evaluate how we deliver the content as it relates to HIV prevention. Because as you know, pharmacists are very accessible in the community. And a lot of times pharmacists are the first individuals that patients and customers come to in the community setting for information and patient education. And so we want to make sure that we are ensuring that our learners are ready and well prepared to provide education as relates to HIV prevention and also recommendations in this field. And so overall, it really just means that we're preparing our future pharmacists to play a larger role in this capacity.
Okay. So my next question is, how did the partnership with Duke University even come to exist? And why did it choose FAMU?
Well, thank you for that question again. And so our partnerships really started in 2022. And I'll have to give all praises and acknowledgement to Dr. Mildred Brickler, who recently retired with us a few years back, who really pretty much put that partnership together and introduced me to Duke University leader, Dr. Lance Okeke, and his team at Duke University for the E2P project, which is Evidence to Practice project. And this was an opportunity where we had an intensive workshop with our learners who, it was about 2.5 to 3 days of workshop. Wow. Where we were looking at how our learners can impact and get their ideas on how to spread the word about HIV prevention. And so during that workshop, we collaborated, they got some information about the epidemiology, the impact of HIV, especially in the South, and how they can impact their respective communities. And so through that partnership, we've been collaborating since then, and we collaborated on this project, and they chose us, one of the 6 colleges of pharmacy, to partner with them in the South for this wonderful project and initiative.
So FAMU is doing some big and major things. So Dr. Maignan, my question is, what's the long-term goal for this research prevention?
Well, that is a loaded question. If you don't mind, I want to back up just a little bit. So just to give you insight, I am within the curriculum. I teach pharmacotherapy of HIV and AIDS management and other STIs or sexually transmitted infections or diseases rather. And so it's exciting for me that we are going to have a targeted intervention in the classroom that works collaboratively across the curriculum, as Dr. Smith mentioned, but not only to advance the knowledge of the students in the classroom, but ultimately to see this translate into clinical practice, which is really the whole objective and what this college represents, what we're here to do. So in doing so, as pharmacists being accessible, those preventive methods, maybe, I'm not sure how many of you are realizing, but prevention of HIV and AIDS is not simply abstinence or condom use, okay? It's transformed into the shape actually as oral formulations, as tablets, or as injectable formulations. And so in the classroom, I'm passionate about ensuring that our students, our learners are informed. Okay, and so not only for treatment, but also, like I'm saying, for prevention. So what's important here to realize is that as pharmacists, this project focuses on the prevention aspect of that. And so if pharmacists in translation or our student pharmacists are dispensing these medications, counseling patients about them, helping recommend what we call PrEP, okay?
Right.
And so that PrEP is prevention of HIV, pre-exposure prophylaxis. Let me get a little technical here. I'm getting in the classroom for you, okay? So all of that really just to summarize and remind everyone that pharmacists play a huge role as far as access, but when it comes to dispensing, counseling, recommending, okay? So this project is huge, and I'm so excited to be a part of it because now we have a targeted intervention, as I was saying, for students to be equipped and informed and really prepared to go out and really impact what those transmission rates are, what we're seeing in the South. So coming back to answer your question, as far as the long-term goal is that as pharmacists, future generations, creating a generation of pharmacists that, like I've already mentioned, are informed, equipped, and prepared to utilize their skills and even leverage their skills to advocate for these communities in the South that are disproportionately affected. So I've said a lot, but you can see that there's a lot to do, whether it's in the classroom or just for the pharmacy profession.
Yes, and overall, just improving access. So this will definitely help leverage that as well.
So y'all are both doing tremendous amount of work that is good for the communities. So my next question is, how did y'all both become interested in HIV or this sexual health?
Well, thank you for that question. So for me, I'm just going to be honest. Infectious disease or HIV has never been my initial strong suit. I thought coming into this field, I always ran away from infectious diseases. So I usually tell this story to my students all the time. I thought I was going to be a neuropsych pharmacist.
What's that?
Basically looking at more of how the brain works, looking at disease states such as Alzheimer's, Parkinson's, depression, bipolar, etc., because that was, where my interest initially was. But as I went through my training and residency training at Tallahassee Memorial Healthcare, I found a love for infectious disease. And I felt like doing this work, it was almost like I was a detective. I was that Inspector Gadget looking to find out, okay, what's the bug for the drug to treat this infection? And so it became very, very interesting to me. And so through my work at TMH, I became one of the antimicrobial stewardship infectious disease pharmacists there. And I was there for several years before transitioning to academia. And so there is where I built my love for infectious disease and my interest, and therefore, got some additional training in infectious disease and some certifications in that arena. And then, had students who I created an infectious disease rotation, had students that rounded there at the hospital with me before transitioning here to academia. And so my love and my training in infectious disease really brought me here to this point now. And so I would just say, I love infectious disease now. As you can see, I'm very interested in, especially in this project with HIV prevention. And so because I feel like we can make a greater impact in training our students and getting out the word and helping with prevention overall. So that's where my interest came, was through my training.
As for me, and I just to back up, it's funny, I met Dr. Smith years ago at Tallahassee Memorial Hospital, and she was the lead in terms of the infectious disease for antimicrobial stewardship. So seeing her, I was always inspired as far as infectious disease. And my passion for HIV really started with a person close to me growing up, actually learning that they were HIV positive and seeing how what I realized that were stigmas that affected them. That sort of ingrained into me at an early age, just that the compassion and the empathy that was necessary when you're delivering care. And over time, watching movies, I really learned about just really the evolution of the disease and how it was stigmatized in this country and around the world, really. And pairing that with being a pharmacist and a pharmacy student at the time, I pursued opportunities. And so working in a pediatric clinic in Baltimore near Johns Hopkins, that was, I was really immersed in the patient care, working also as an intern at AIDS Healthcare Foundation, also gave me a lot more insight. And so that paired together, as a professional, I was always interested, always excited to dive and learn and really impact. And then transitioning to academia, it became such a, I say this, but it was divine, because to have the opportunity to be in a classroom, it felt like passing the torch. So there are students, there are people who are just really unaware of the care that's necessary, because this is a public health issue. So it goes further than the medications. It's the person, the community. And so just as pharmacists, it was such a privilege to be able to do this. So my passion just started early on, and it pulled on my heart at an early age because of that person. That's where it started.
Okay. So just to give like a quick like little backstory, my mom, she used to work at a nonprofit clinic which helped people with HIV and AIDS, and she was a caseworker. So the reason why she worked as a caseworker was to help people who were like not that rich, didn't have good Medicare, so they were looking for the pharmacy to help them with their medicine when they were diagnosed.
Right.
So my question is, why is this work so important? I know you talked a little bit about it, but Dr. Smith, what about you? Why is this work so important for you?
Well, for me, I would just say overall, this work is very, very important, because I feel though with this epidemic that we're in, it does impact marginalized groups. And I feel that we as a college, we as a university owe it to the communities that we serve. And we owe it to our students to strengthen our curriculum with regards to HIV prevention. And so although we do have courses that do focus on HIV and prevention, we definitely can strengthen our curriculum to integrate it throughout the curriculum. And I think it's an effort for us as far as laws are changing now, where laws are allowing in different states where pharmacists can prescribe and recommend medications for prevention and even PEP, which is the prophylaxis, in case they have any type of exposure to someone who's infected with HIV or AIDS. And so I think the way in which the government is moving, the way in which healthcare is moving, the way in which public health is at this moment in time, we are at a critical state where we really need to continue to educate our students, educate our patients, but we got to, as Dr. Maignan stated, equip our students. And so we are doing what we can right now in the classroom, but I do believe that we can definitely enhance what we're doing. And so this work is very impactful. And, going through the collaboration with Duke initially in 2022 for the E2P really opened my eyes then of the work and the interest of our learners, but also the work that we can do to better serve our community.
So my last question for y'all is, like I said before at the beginning of the video, it is Women's History Month. And both of y'all have done so much stuff. I read your resume as well when I wrote the article about you in the program. And I know you did so much progress in pharmaceutical science. So my question for both of y'all is, what is it like to be a woman in a pharmacy science field?
Well, I'll start, and I laugh with this because when you ask these questions, sometimes you don't take a second. You take a second to reflect and realize that you are a woman in the sciences, and that's a privilege.
Yes.
So to carry that responsibility and that leadership, I can tell you that for some, and I'd like to really highlight Dr. Smith, it's inherent. She does it because that's who she is, and she gives of herself, and she leads and she mentors because that's who she is. So I'm speaking for her, but I'm going to say that because she embodies it. And so watching her, I can say for myself to rise to the occasion, to see others that are already in this position, leading that, not utilizing it as a title, but more as a way of life, really just embracing some of the skills and talents that are inherent. I like to say that it feels like a wake-up call. So your question alone reminds me that that's what I am. But aside from being a mother, a wife, a daughter, a friend, I I think we're here, and we're just always trying to move the mark and just advance the next generation of young women so that they can maybe go a little further, maybe see it a little different. So hopefully that answers the questions, but it's layered here.
Yeah, and I would just have to add to what Dr. Maignan stated as well, is that just being an example for others to follow. I think that we as women are very impactful in the world here. And I feel like women rule the world, like Beyonce would say. But I would just like to just state that, being a woman in medicine and in this field is very rewarding. I see it as an opportunity each and every day to have an impact on someone's life, whether it's my students, whether it's the patients that I serve, the community that I serve, here at the college where we are serving, because that's what we are. We are serving the community and ensuring that our learners are trained so they can then go out and do the same. So I think as a woman in medicine, we're just natural nurturers, I believe, and we usually, help with managing the home, but I look at this is our home. FAMU is a family, and we are here as women to make that impact as well.
Just to quote Dr. Richard Mitchell, who we had on a previous episode, if you want to get the job done, give it to a Black woman. And you both have done so much astounding work. And I know I kept on saying throughout the episode, but y'all have. Y'all helping so many communities. And not only that, y'all setting an example to other Black women at this university. So I want to give y'all a round of applause for that.
Thank you so much.
Thank you so much for coming. I know y'all have such a busy schedule, but I feel like this episode was a good one. And I really hope that y'all continue to push and change with the communities y'all are helping and the learners as well. So thank you.
Thank you for having us.
Thank you. Yes.
Thank you.
This is nice.
Thank you guys for watching this episode. We can't wait to see y'all for the next episode of the What Podcast, Wellness, Health, Advocacy, and Transparency. Once again, I'm Kazan Allen, and I'll catch you on the flip side. Thank you.
Thanks.